What is coronavirus COVID-19? COVID-19 is a new illness that affects lungs and airways. It spreads through direct contact with droplets from an infected person. Symptoms can include fever, cough, high temperature, and shortness of breath. In severe cases, can cause pneumonia or breathing difficulties. Can even be fatal in the more severe cases, especially in the elderly and those with pre-existing conditions. As of the 11th of March 2020, the World Health Organization has declared the coronavirus COVID-19 outbreak as a global pandemic. In the African context, while as of the 12th, the infection rates remain low as compared to other countries, we have to be alert to the fact that the virus is on the continent in at least 11 countries. This means precautions have to be taken to seriously mitigate any kind of potential full-blown outbreak. Symptoms of a cough, high fever, or shortness of breath do not necessarily mean you have the illness. The symptoms are similar to other illnesses that are much more common, such as a cold or the flu. It is unlikely to be coronavirus if you have not been in contact with someone with a confirmed coronavirus diagnosis, or if you have been to an area or country of high risk of coronavirus. If you have any doubts, please contact the Ministry of Health online or by telephone. Face masks play an important role in places like hospitals. There's very little evidence for widespread benefit for the public. Unless you are really sick, do not wear a mask. This is important to note. Wearing a mask can greatly increase your risk of getting infected if you do not wear the mask properly. As individuals, we have an important role to play, but society-wide measures are what are going to help greatly stem the spread of this virus. Restricting yourself from mass gatherings will also help fight any spread in our communities. Sporting gatherings, concerts, and the like must seriously be considered in this time. Contact the Ministry of Health about self-isolation. Pandemics of the last century all had one common denominator, in that communities that practiced very good hygiene had very few infections. Wash your hands in water with soap thoroughly for at least 20 seconds. Do not forget your thumbs and underneath your nails. If you cannot wash them, use hand sanitizer gel and make sure the hand sanitizer gel is at least 60% alcohol in content. Avoid close contact with anyone coughing or sneezing, thus avoiding the airborne droplets that spread the virus. Avoid touching your face at all. We do this unconsciously 100 times, so we have to be conscious. And stop shaking hands. Especially avoid touching with unwashed hands, as the virus can enter your body through your nose and your mouth. If you do cough, do not cough into your hands. Cough into the crook of your elbow or into a tissue and dispose of soon after then. Clean your hands immediately. Also see advice on how to wash hands properly on the WHO website. Be sure to check the Ministry of Health website for any updates, as well as the WHO website. So while coronavirus is the anxiety and continue to spread, remember there are things that can be done to fight back. Thank you.